Hi, my name is Braxton Higgins. Your
Hello.
name is?
Taylor Higgins.
What can I call you?
Taylor.
Okay, perfect. Okay, so from your screening, it looks like you're in here for some hip pain. Can you tell me a little bit about that?
Yeah, so depending on what position I'm in, like if I'm like on my hands and knees and I like sit with my legs apart, try to sit on my heels or something, huge pinching pain in my left hip.
So in the description of your sheet, you said that there's some shooting pain. Can you describe that a little bit for me?
At first I thought it was like nerve pain, but then it definitely, when I thought about it more, it definitely felt like it was like a bone or like a ligament pain. I can't tell the difference.
Okay. So do you have any idea on a specific cause or?
I danced.
Okay.
Ever since I was 3 up until I was like 21, I danced competitively. I was very flexible, and we did like super flexibility, so I know I pushed my hip to the limits my entire life, and then just kind of stopped cold turkey when I started having kids.
Okay.
And stiffened up a lot.
And by the way, when I'm writing this down, I'm not ignoring you. I'm just making important notes. So you were a dancer, so that's interesting. So would you consider yourself a visual learner?
Yes.
Okay.
Very.
Okay, so you're mostly just having a lot of pain with certain movements in your hip.
Yeah, and sometimes I have to like pop my hip for pain to go away. Sometimes it feels like it kind of gets out of place. I don't know. Both sides do it, but my left side hurts. Right side doesn't hurt; it just pops all the time.
Okay. So it's just your left hip. There's nothing. It's just one. Okay, just one side.
Yeah, they both pop, but the left one's the only one that hurts.
Okay. So does it affect your sleeping at all?
No.
Okay.
It's really when I do bigger movements or weirder positions and stretches. It's not everyday walking or anything like that.
Okay. Are you currently on any medications I should know about?
No.
For this? Okay. Have you had any labs or testing or imaging on that?
Mm-mm.
Okay. Do you have any family medical history that I should know about? Anyone had diabetes or heart disease? Anything like that?
No, just hormonal stuff.
Hormonal? Can
like,
you elaborate?
My mom has Hashimoto's disease, thyroid disease.
Okay.
That's it. I don't have it. I do have PCOS, but I'm not sure if that would affect that. I have a lot of things reproductively that are wrong.
Okay.
But
so PCOS, so got a little bit of hormone imbalance.
Definitely. I have incompetency, if that matters. I don't know if that would make a difference, but my cervix is insufficient where it doesn't hold shut, so my muscles are kind of whack right there.
Okay.
I have to have them stitched shut when I'm pregnant.
Okay. So this hip pain, does it cause any functional limitation? Like, is it harder to do things because of it?
Yes.
Okay.
Definitely.
All right. So do you work?
No.
Okay.
I'm a stay-at-home mom.
Okay.
A very active, soon-to-be toddler.
Okay. So you mentioned you have a toddler at home. Do you live with anyone else?
My husband and my daughter.
Do you have a hard time getting around the house at all because of the pain?
No, not at all.
Okay. Did you have any limitations previously to this injury?
No, I mean, with dancing, I definitely was not naturally flexible. I really had to push myself to get to where I got. A lot of other girls, not that you're naturally that flexible, but some my dancer friends, it was easier for them to stretch and get flexible, and it was a lot harder for me. I've got a lot shorter limbs and different build than they did. I don't know if that matters, but I had to push myself really hard to get where I was.
Okay, that's cool. Flexibility's always been a goal of mine because I can hardly touch my toes.
I know.
So, what do you like to do for fun? Like what?
Zumba.
Zumba?
Yeah.
So that would affect Zumba a little bit.
Yeah, you know, only when I do like squatting.
Okay.
It doesn't hurt when I'm just standing up straight dancing or anything. I can kick, I can do things, but it's when I'm squatting and my hips are, I don't know, parallel or not parallel with my knees.
Okay. Is the pain ever bad enough to cause any problems in the restroom or with hygiene?
No.
Okay.
I mean, okay, actually, like, because I was a dancer, I do shave in the shower, like, shave my legs. I'll put my leg up on the wall to shave my legs, and sometimes I can't twist on this side as I could with my right leg, if that makes sense. I can't twist certain ways to get angles of my leg when I shave.
Okay.
So, I'll get like a cramp, big Charlie horse cramp, that I have to put my leg down and have to massage it or something. But then it keeps hurting and throbbing for a while.
So it's kind of like it feels like a joint pain, but also muscle
cramping. I can't figure out what it is, but it's been a few years of it, especially since having babies, being pregnant.
Okay, so do you have any problems with? Have you ever had any problems with your heart or breathing or circulatory system?
No.
Any skin issues or sores?
I have really sensitive skin. I'll get patches of eczema when I'm pregnant. And then I also have a lot of sensitivity to like hard water or something weird. I'll break out and just itch. Not that I have sores or anything, but I'm just sensitive to a lot of things where I have to use special ointment just for it to go away. I don't know what it is.
What would you say your main goals are for coming into PT?
To figure out whether or not this is, if it's a bone thing, a joint thing, or like a muscle. Figure out specifically, you know, what that is, and then just learning whether or not it can be fixed. If that's surgery or if that's just PT.
Okay. So I'm going to kind of read back my main points that I hit, and then go ahead and let me know if I missed anything or if you want me to add anything else. So you've got some hip pain, sharp, aching, shooting, throbbing kind of pain. Because you think it's because you were probably because you were a dancer, you're hyper flexible, hyper mobile. It doesn't affect your sleep at all. It sometimes feels like a muscle cramp as well. No medications I should know about. You haven't had any imaging or anything like that yet. Let's see. Living with your child and husband. You don't have any problem moving around the house, going out in the community, nothing like that. Okay, you can drive fine. Okay, you just have some pain. You have some pain doing things you like, so Zumba hurts and just random movements kind of hurt. You've got PCOS, so some hormone imbalances. A little bit sensitive skin. Does that sound about right?
Yes.
Okay. So now we're gonna go and do some testing. So we're gonna test your range of motion, your strength, your mobility, and your balance. We're gonna see if we can put together a plan to help with this issue that you got going on. Does that sound okay?
Yes.
Perfect.
That's good.
Okay.
Okay.
Good meeting you.
You too.